Hey guys, I'm Dr. Tanya Jain and I have very recently begun as a first year radiology resident, and I'm so sorry for the late upload because I was very busy personally and with new work responsibilities. But today I've come up with a very important topic for this video, that is how to revise your final year subjects. So these subjects are huge, they are massive, they are extremely important, so you have to give them due weightage and due respect, but you just can't go overboard with them because remember, you have 19 subjects to do. These are only your 4 big subjects, that is medicine, surgery, obs, gynae and peds. So we'll just quickly see how to revise them in the very short period that you have left before NEET PG, and I hope full force में all of you are studying really hard and revising, most importantly revising everything till the last minute. So one thing you have to keep in mind is that seeing how much weightage a particular subject has. For example, obs gynae has a lot of weightage, but peds on the other hand has almost as much weightage as FMT. So just don't go very deep into the subjects where you know weightage is not that much. And keep in mind the difficulty level. So NEET PG usually has easy to moderate questions with a few tricky or tough ones. So keep that in mind. Get your basic concepts clear first and revise the basic most important things because they are going to come in your exam. And most of these subjects are very well integrated, especially medicine. So ऐसे नहीं कर सकते कि पैथ छोड़ दिया, फार्मा छोड़ दिया. Not at all. Medicine में lot of questions will start as a medicine question, but they will end up asking you a pathology translocation or a pharma drug that you have to give or some side effect. So you have to remember that allied subjects भी साथ में करने हैं, equally important if not more. And don't forget to do niche topics. Every subject will have some things that they definitely ask over and over again, because as an intern, as a PG resident, certain emergencies and certain important things you have to know about these very strong subjects. So starting with the most bulky one, medicine. So again, please stay restricted when it comes to medicine because medicine is an ocean. You can never just complete everything. So medicine typically has 20 to 25 questions. Now what to actually just aim at in this last time? One thing I found really useful was the DAMS DVD because it was a very concise source for all the units. So in my time it happened in an integrated way. This year it did not, but even then the notes will be concise, something you can revise at the last possible minute. Another source that I found was very good was Deepak Marwa sir's videos on Prep Ladder. They are again a concise revision tool for medicine. Thirdly, if you have done TNDs from any institute, anywhere, and you have made the discussion seriously, definitely revise your TNDs. They always have updates. They always have important topics that will feature in the exam. So you can definitely revise TNDs. Some topics that you just cannot miss. One is emergencies, medical emergencies. Obviously none of us can miss. If you don't have a consolidated source, I did do the emergency course from DAMS in my time, but mostly all your notes from wherever place you may have made them would have an emergencies section where you would have covered important and common emergencies, so you can go through with that only. Then electrolytes is something that is always missed out. Please don't take this lightly. Questions based on electrolytes and ABG for that matter will come in a lot of numbers. Like you will be shocked that there are 4 to 5 questions just on ABGs, which can be simple to moderate to a little tricky, but they will ask the basic things. So you have to revise ABG and electrolytes before you go. And in electrolytes, don't forget to do the ECGs. And electrolytes, again, I found Deepak Marwa sir's videos very helpful. So you can quickly go through them, especially calcium, magnesium, stuff like that, hyperkalemia, hypokalemia. So don't forget to do these. ECGs again, but don't go so much in depth because ECGs only very basic questions, basic diseases that are easy to pick up and easy to treat are asked. So get your basic ECGs clear and simple diseases clear. Then another area where I feel people forget to do or take it lightly is rheumatology, and rheumatology is heavily tested. You would think that some cardiology or another topic is tested way more, but rheumat definitely wins out because it has smaller, like small content. It does not have too much to do, but things are so specific. Everything is so MCQ based. So definitely, like, there were 2-3 questions just on ankylosing spondylitis last year. You cannot afford to miss rheumatology. Again, something that is becoming extremely popular these past few years, whether it is NEET PG or NICT, is blood transfusion. You have to be thorough with blood transfusion. पैच से करो या मेडिसिन से करो, कहीं से भी you have to do blood transfusion, especially the complications. Every electrolyte you have to know क्या बढ़ सकता है, क्या कम हो सकता है, anything, any complication, early complications, late complications. So you have to do these. You can do these. First aid has a really nice table about blood transfusions, and Sanjeev Chitragar sir's notes from DAMS were very good. They covered almost everything on blood transfusions. So I will really recommend that. And another topic which nobody reads but is somehow tested so much is nutritional deficiencies. And nutritional deficiencies sirf medicine se nahi, peds, PSM, biochemistry, like too many questions on nutritional deficiencies, your vitamins, minerals, all of these clinical questions will come. So do not leave these things at all. Again, like I've said, allied subjects, pharma and PAD, so you can't afford to miss the systemic aspects of both these subjects. So the next subject I'm covering is peds. I'm covering it along with medicine so that you can do the systemic peds along with medicine. So although it is not a long subject like medicine, surgery, gynae, but it's a final year subject, and people tend to do delve a lot into peds, but keep in mind that it only has 8 to 10 questions, so you have to do it, but do the important things first. And mostly the questions are clinical, so focus on that, and don't forget to do general peds. Mostly general peds is asked. Again, especially nutritional deficiencies, things like milestones, neonatology, of course, you have to cover. So basically, don't ignore general peds, don't ignore emergencies. And something that you cannot miss in any exam is vaccines and immunization. So ped se bhi karna hai, PSM se bhi karna hai. Just don't miss anything about vaccines. Whether it is a simple fact or a difficult fact, vaccines will come for sure in a lot of weightage. And things that are also a little bit niche to peds are CVS of peds, especially something like fetal circulation, the radiological x-rays of congenital heart diseases and all. So these are specific peds topics that they tend to ask again and again, so definitely do that. Again, nephrology is also like nephrotic, nephritic, your henoch-Schönlein purpura. So these are very specific peds topics that you can't afford to miss. Again, CNS and some part of neonatology. So basically, I want to again emphasize that you cannot simply skip general peds, nutritional deficiency and immunization, because they will heavily come in the paper. So the second subject that I find massive in terms of its content is surgery. So basically, my main notes were Dr. Rohan Khandelwal sir's notes from Marrow. But if you have to revise these notes, it's a very daunting task because the content is simply a lot, although it's very, very concise, but surgery in general is a vast subject. So what I did was I started doing the revision videos, the rapid revision videos and the TND videos of Marrow, specifically for surgery I'm talking about. And they helped me revise my own surgery notes in a much quicker way. And I had always struggled with revising my surgery notes. So this is sort of a proxy, but you have to go through your notes, but you can use these videos to supplement that and just get in the hang of it. Sometimes notes boring ho jate hain and we watch some videos, so it helps us build momentum better. Secondly, DAMS DVT was also good, and so were the TNDs. So any institute you have done TNDs, I always recommend that you should revise them before your exam. Another thing you cannot skip in surgery is the allied radiology. Although radio is allied with all subjects, like there are so many image-based questions that are purely radiological or from other subjects, but they have a lot of radio like X-rays and MRCP, CT, things like that really come along with surgery. So don't skip the radio part of surgery, especially the hepatobiliary part. Then certain topics that you can't afford to miss. So what happens is everybody starts with GIT. हम इतने डरे रहते हैं GIT से. We start with GIT, we end up just going into GIT, not finishing surgery or GIT in the process. So ऐसा नहीं करना है. GIT is definitely important, especially hepatobiliary and congenital disorders, pancreas. So these are very, very important. But this is not the only thing of surgery. Na? It is 1/3. So you have to do general surgery, you have to do miscellaneous topics. So my advice, उससे start करो जो हमें पता है doable है, like general surgery. So we know there will be so many questions on trauma. Basic things come in surgery always, like cannulas, simple instruments, and also emergencies. Again, subjects के लिए emergencies you cannot miss. Surgery में especially acute abdominal conditions, pneumothorax. So ये इतनी बार पूछे गए हैं कि we just can't afford to miss them. Miscellaneous, also urology, very important. So urology as well as hernia, and urology trauma is something that people are asking a lot, both in NEET PG as well as in NICT. So don't miss that out. Again, vascular component like DVT, the new CAP classification. So all classifications that are new in surgery are automatically very, very important. You have to revise them before going. Again, breast and thyroid, मतलब आए ना आए ये छोड़ के तो जा ही नहीं सकते. So you have to do breast, you have to do thyroid. So these are some essential things that you should do before you delve into GIT and all its contents. Lastly, my favorite subject, my favorite UG subject, Obs-Gyne. So 20 questions. And why Obs-Gyne is so important? Because content wise it is less than medicine and surgery, but it will fetch you almost the same number of questions. And Obs-Gyne is easy, सबको अच्छी लगती है, सबको अच्छे से आती है, and it's very doable. In fact, I would suggest अगर आप अभी अपना revision cycle start कर रहे हो and you want to start with some big subjects, Obs-Gyne definitely on my priority, because you will be able to do it. You will get a confidence boost. Jaldi hoega, and you will feel like one big subject and 20 questions are in your pocket. So again, the DBT was very good. Marrow revision videos are also good if you want to revise. But personally, my notes that I made from DAMS were like, they were golden, and I revised them again and again. So you should, if your notes are on your tips, you can revise them in a quick way. And another very important thing is TNDs. Again, TNDs have updates, they have important topics, so don't forget TNDs. Some topics that are unmissable again in Obs-Gyne is, one is labor. Everything about labor, everything about the complications of labor, especially PPH, and they tend to ask very practical questions. So if you have been to the wards, so it will be definitely easier for you. They ask about lie, presentation, basic complications. But if you've not, just practice practical questions about labor, about partograph, so very basic things, bishop scoring, things like that. But you have to know in and out for labor. Again, similar to labor, abortions, molar gestational, neoplasms, ectopic, very, very scoring, very, very easy. Very easy. So you have to do these topics. You can't go without them. So nowadays they are also asking a lot of Mullerian anomalies. All of your arcuate, bicornuate, all of these different types, their complications. There was a lot of focus in last year's NEET PG about the complications of these Mullerian anomalies. So do that for sure. Also do investigations. They are asking a lot of radiological investigations when it comes to Obs-Gyne. Which is the best investigation? Which is the first investigation for all of these Mullerian anomalies? So definitely do that. Again, contraception. Cannot emphasize how important it is. From Obs-Gyne, from PSM point of view, so you have to do it from both of these places. This is an integrated topic, you cannot miss it. And don't miss practical questions. Things like OCPs, how many, if you miss how many pills, you have to take you have to start your pack again, or how many missing of how many pills is acceptable. So all of these very small practical things that is what they're asking these days. So definitely go through contraception. Again, cervical cancer, everybody knows it's important. Staging is relatively newer. It was changed. So definitely do that. And something which is an integrated topic again is vaginal discharges. Again, derma, from derma point of view, from PSM point of view, from obs-gyne point of view. This topic you cannot miss. All the kits, the colors, the number of the kits, the drug dosage, the investigations, everything you have to do. And you do this, you are definitely sure about 2 questions that are going to come and you are going to nail them. So don't miss out on these very important topics in each of these 4 subjects. So I know they are massive, but start somewhere and you will definitely get through the important things. Once you get through the important things, you can move on to the next subject. Okay, don't give so much time to the final year subjects that you can't do your first, second year subjects especially, which are also very important. I hope that you're here till the end of this video and this helped you out. Hopefully you are able to revise these subjects much better now. And let me know if you want any particular videos, and I'll definitely try to be more regular hence on. Thank you so much. Bye bye. All the best.